valve disease symptoms that you should look out for, which are, and let's show the viewers right there, chest pain, doctor, shortness of breath, palpitations, swelling of the ankles, feet, or abdomen, weakness or dizziness, quick weight gain. Can you chime in on these symptoms, please?
Well, yes. In reality, most of those symptoms that you just described occur when the disease is advanced.
Okay.
The most challenging thing is being able to detect the disease in early stages so we can treat it properly, and it will improve definitely patients' outcome and longevity and quality of life. But really, for example, let's talk about obstruction first. If you have an aortic stenosis or obstruction of the aortic valve, means that all the blood coming out of the heart is going through a pinhole. And can you imagine feeding of blood of the brain, heart, kidneys, the rest of the body through a very limited amount of blood? The symptoms that will produce are, for example, syncope, you pass out. Shortness of breath, because you can't, all the blood is accumulated inside the heart. And if it goes on time, the symptoms get aggravated. By the time you have all the plethora of symptoms that you just described, these patients are really ill. We would like to detect this early. So how early is early? So you have, for example, aortic obstruction is common in the elderly patients. Unless you have congenital disease of the valve, because you were born with, instead of having 3 doors, like Dr. Sanabria explained, you have only 2 doors.
Right.
And then you call it bicuspid valve. So in reality, all the symptoms of valve disease are manifestation of the heart is failing.